Excellent. So we are waiting for a few folks to continue to join us this afternoon. But thank you to those of you who are here. This is our third webinar that we've had this fall focused on high-path avian influenza with updates from folks in the industry, but as well as tools that growers in our membership can use to either monitor or prevent high-path avian influenza within their flocks. And so today we are going to once again kick off with Dr. Shauna Voss from the Board of Animal Health with a kind of status update. And I know there are a few folks on here who are joining us for the first time. So just an FYI and a reminder to everybody that the information on these webinars are for our membership only. And if there are folks who wish to share some of this information publicly, to let us know, we can connect you with our speakers afterwards. So Dr. Voss, thank you again for always joining us and sharing the information that you have with us and our membership. So go ahead.
Thank you. I'm not able to share my screen. Is one of you able to? There we go. All right, are you seeing my screen?
Yes, ma'am.
All right. So I'll just give you a quick situational update on our current status of high-path avian influenza in Minnesota. But I also just want to give a shout out before I really get going here to our whole response team in Minnesota, because it's not just the Board of Animal Health that is doing this. We've got a lot of partners in the mix. And so Minnesota Department of Agriculture has provided their Office of Emergency Preparedness and Response. Have stood up the incident management team to help us out, along with both local and national USDA staff members have been helping. Our Minnesota Department of Health is certainly helping to make sure that all of our producers and our response team members out on the farm are staying healthy. And then, of course, the University of Minnesota has been helping with some extension efforts, as well as all of the lab testing. So where we're currently sitting today is, as of this fall, which our outbreak started this fall on October 8th, we've got 20 cases that have been detected. And this includes both confirmed cases at NBSL, as well as our presumptive positive cases that happen at our null lab, which is the MPTL and the VDL. That includes 15 commercial turkey farms, 2 commercial turkey breeder farms, 2 backyard or non-poultry, WOA non-poultry farms, and then 1 commercial table egg layer farm. And because this is an ongoing event since the start of the outbreak back in March of 2022, our total Minnesota case count stands at 130 cases. And that tallies up to about 5.6 million birds that have been impacted. This is becoming kind of a long graph, but this is our epi curve from the start of the outbreak. So you can see we had a lot of cases in the spring of 2022. Our fall outbreak is that next summary of green bars across the bottom. And then the bars over on the far right-hand side represent our fall cases. And then I know a lot of you have seen this before, but that yellow line that's over on the left-hand side represents our high path of 2015, just for comparison. And then the red line is the cumulative cases since the start of the outbreak. And this graph is a little bit easier to digest as far as just what our fall outbreak, our current fall of 2023 outbreak looks like. So you can see that we continue to see a number of cases each week, 1 to 2 per day, and then that kind of has been totaling up to about 3 or 4 cases per week. And so we continue to see cases even as of yesterday with new presumptive positive cases. And I just want you to be aware that, you know, for every case that we have, that's a commercial case, we do establish a control area around that infected farm, and that impacts a lot of people who are not infected with the virus for surveillance testing and permitted movement testing, because you all get quarantined if you end up in one of those zones. And so I just want to let you guys know that our team is working really hard to make sure that we can release those control areas as soon as possible. And so we have already closed 5 of those control areas. We've got another 5 that are set to close within the next couple of days, assuming everything goes well. And then, of course, as we get new cases, those remain open. So please continue to do all of your surveillance testing and permitted movement testing and requesting those permits if you're in a control area until you receive notice that either your quarantine has been released or that that surveillance zone has been closed and you are no longer required to do any of that testing. If you want to know where you're located in relation to some of these infected premises, we do have a map on our Board of Animal Health website that you can type your address in, and it will let you know if you are either in a control area or a surveillance zone. And then a pop-up does appear as far as what some further instructions will be if you are in one of those zones. The Minnesota Poultry Testing Laboratory and the Veterinary Diagnostic Lab continues to do all of the testing for this event, and they're doing a great job. Just so you guys all know the schedule, they are doing, the MPTL in Wilmer is doing routine testing Monday through Friday, and our normal run schedule is at noon. If they receive a lot of samples in the afternoon, they will do an 8 o'clock and 8 a.m. run in the morning, and then they are available for sick bird testing, which may happen off schedule. But that does require approval from the Board of Animal Health and arrangements with the laboratory staff to make sure that that can happen. So the Minnesota Poultry Testing Lab can do sick bird testing, again, off schedule, and then on Sundays they're available on call. The Veterinary Diagnostic Lab in St. Paul does their routine testing Monday through Friday at 7 a.m. And then sick bird testing is available off schedule with approval. And then they are on call for Saturday testing. And that has not changed throughout this event. And just so you know, if you are in a control area and you need permitted movement testing to happen on a Sunday for movement on Monday, that does need to be prearranged with the board and with the laboratory. And again, that testing, if it is approved, will happen Sunday at noon. And so drop off for those samples happens between 11 a.m. and noon on Sunday, if prearranged. We're coming upon Thanksgiving, and so there will be some alternate hours available for Thanksgiving. Both labs, both the MPTL and the VDL, will be closed on Thanksgiving Day, on that Thursday, but they will have staff available for on-call or sick bird testing if needed. And then on Friday, both labs will be staffed during their normal business hours, but the only testing that's going to be occurring will be avian influenza testing for the outbreak and sick bird testing. So no routine NPIP testing or other diagnostic type testing will occur at the labs on that day, but the labs will be available for avian influenza testing. And these are some numbers if you want to jot them down for if you need to contact us to arrange for some testing. These are the numbers. So for sick bird testing, I recommend you call me directly to make me aware of the situation, and then I can help make arrangements with the lab. But both Stacy Pollock at the MPTL and Dr. Rivera at the VDL, their numbers are listed. And then for Sunday permitted movement testing, if you can just call the MPTL directly, and either Board of Animal Health or lab staff will make sure that those arrangements can be made. One final thing that I just wanted to mention, this is a new slide that I threw in here as of about 20 minutes ago. The USDA put together an infographic for the high-path turkey case control study that they performed last year. And I think some of your members participated in this study. And it's just a nice graphic for some of the risk factors that they identified and some biosecurity improvements that could be made just to kind of make sure that we're all kind of keeping on top of things as best as we can and trying to reduce our risk. And so the link for that is there, and we can certainly send it out afterwards as well. But it's a nice infographic to kind of look at what our risks are and how we can try to prevent introductions of avian influenza into our flocks. You can continue to follow what's happening in Minnesota on the Board of Animal Health website. If you click on high-path avian influenza, it will take you to all the information you need on the response and what is happening. And then just finally, a reminder, we do have an avian influenza hotline that can be called for any poultry that might be experiencing clinical signs, and there is a sick bird report. But if Minnesota Turkey Grower Association members have sick birds that they need to report it, please call me directly, and my cell phone number is listed on this slide. And that is all I have.
Awesome. Thank you, Shauna. And again, if folks have questions, you're welcome to drop them in the chat here. Otherwise, we will also have questions at the end of our webinar today. So again, thank you, Shauna, for the information that you share with us always, and for always being available to our membership. So next we have joining us is Erik Hildebrand with Minnesota DNR. So you guys continually hear from the Board of Animal Health and the Department of Agriculture, and we've had a number of requests for folks to hear from the DNR. So Erik, thank you for joining us and sharing some information about what you guys are seeing within the wild bird population.
Yes, thank you, Ashley. I'll share my screen here. Let me know if you can see my PowerPoint.
Yes, sir.
All right, awesome. So yeah, my name is Erik Hildebrand, and I'm the Wildlife Health Supervisor for the Minnesota DNR, and here to update on some wild bird surveillance work that has been taking place. We in the DNR and the state are assisting the USDA Wildlife Services National Surveillance Plan. And so the USDA folks have the lower 48 broken out by the watersheds, and then they assign a certain amount of goals of samples per watershed per season. And the seasons are the summer season, fall, and winter. And so here you can see the main watersheds of focus in Minnesota. And some of the results that we had, the summer goals in the first column, you'll see the couple watersheds that we had. The collections of those birds were really targeting live caught and released waterfowl. And this would be any species, dabbling ducks or diving ducks, but not geese. And so the summer goals, we worked with a number of the federal partners and within our state banding coordinator to collect much of these samples. And you can see we reached all of our goals. And then moving over into the fall, from September through the end of November now, that is our fall goal. And that is mostly targeted by collecting samples from hunter harvested waterfowl. So when duck hunters are out in the marshes or on ponds, we have staff that go out and wait at the boat landings where they launch their boat or their parking areas. And then we ask them when they get back if we can sample their birds and swab their birds. We do have a number of the watersheds have reached their goals, but you see the upper Mississippi Blackroot, that bottom watershed, that's kind of the southeast part of Minnesota. We are still collecting samples currently, and the duck season goes until November 26th this month. And so we'll be at the boat landings collecting samples till the end of the duck season. Then we dive into winter and spring goals. So that was aimed at the December through April time period, and really focusing just on the one watershed. And much of this is also due to the sheer, as you're aware, in Minnesota, that time of year there's not much open water, and so looking at the watersheds, where would we be able to get an adequate number of samples? And so the Minnesota watershed stood out with that river and some of those warm water discharges that we do hold an overwintering population of waterfowl. So even though there is migration that occurs in the spring and in the fall right now, where many birds leave our state, in the same breath, I'll say we have an overwintering population of waterfowl that stay here year round. And so that's aimed at getting a number of those species. And let's see, to the far right, you can see what we've collected so far. Of our goal of 1919 samples, we've collected 1544, and then the table at the bottom. So these are test results since September 1st and by watershed. And you can see the top portion is the AI matrix positives that were detected. So of those samples, we had 302 detected, but we also had 785 not detected, for a total of 1,087 samples. And of those positives, of the AI matrix hits, we did have 8 that were high path AI. And these were 2 from the Minnesota watershed and 6 ducks from the Mississippi watershed. And there's a breakdown of the species in the table above. And so in years past, USDA protocol was focused on dabbling ducks, such as mallards and teal, and gadwalls and widgeons and other dabblers. This year, however, they opened up the sample size to allow diving ducks into the cohort of samples. And so we did see detections of HPAI in 3 diving ducks, redhead and ringneck duck. So I thought that was interesting. We also continue to investigate any wild bird mortality event. This would be if the public or staff report 5 or more dead or dying or sickly individual birds in a localized area within a short window of time. That leads us to believe that there's a potential event taking place. So we collect fresh carcasses and get them sampled for HPAI. Along that lines, we also submit those for other diseases because birds do die from other causes, not just AI viruses. The website. So our DNR website, we do have a avian influenza website. It's a great resource that we really point our hunters and the other public to go to. Just mostly because these duck hunters are handling wild waterfowl, we want them to be aware of the virus and what that means. You know, if they do own their own flocks or know people that own flocks, just so they're aware of what this virus has the potential of doing. The third bullet here, weekly waterfowl reports. So Steve Quartz in our department posts a weekly waterfowl migration report. And this is compiled from wildlife managers across the state. The audience is really targeted at duck hunters or waterfowl hunters. As a hunter looks to these reports, they may choose a certain area of the state to go hunting based on more waterfowl in one area of the state than another. So it's a good resource to kind of get tabs on local intel from those managers of where waterfowl are at that week. And DNR, we also continue to participate in the stakeholder meetings and legislative briefings to help keep our partners informed of any of our wild bird surveillance and results that we get through this fall and upcoming winter. Ashley, I think with that was my last slide.
All right. Well, thank you. Again, if folks have questions, go ahead and shoot them in the chat, or you can connect with us afterwards. So if you guys have been on our previous 2 webinars, you know that we usually have some sort of regulatory update, HPAI update, and then we like to have information about tools that you as a grower can use, again, to help prevent HPAI or monitor things within the environment to prevent HPAI. So we're excited to have Abby here. She is a poultry extension educator with you at the University of Minnesota, and she's going to share some research with us about biosecurity training. So thank you for joining us, Abby.
Okay, you can see my presentation slide.
Yes, ma'am.
All right, fantastic. So many of you probably have heard from me over the past several years about biosecurity, and you're probably tired of seeing me, but we have some new information that I want to be able to share with you. But first, I want to review some of the basics in biosecurity that have really helped me evaluate and assess, like if I'm seeing an NPIP biosecurity plan before you submit for an audit, I'm going to look at your biosecurity plan through these types of lenses or tiers, as we might say. And so the first tier, there's 3 in total, is going to be conceptual biosecurity, followed by structural biosecurity, and then operational biosecurity. And these 3 lenses make the whole of biosecurity as we know it. And by breaking down biosecurity into these 3 tiers, it might help you to rethink biosecurity or think how things are differently, or how maybe you need to adapt biosecurity as the seasons change, as your production changes, etc. So that first tier of conceptual biosecurity is going to involve your environment and what's around the farm premises specifically. For some farms, maybe more specifically our small farms, or maybe even the game bird breeders in the state, are they commingling species? Sometimes we're learning that multiple age turkey sites can be a risk with HPAI. What is the environment of the site? Like literally, what's the landscape around you? Do you have water nearby, whether it's a pond, a lake, a river? Do you have wooded areas? Are there row crops nearby that are being planted, that are being grown, that are being harvested? What your location of the premises is within your production system. Are you super close to maybe at the feed mill, and so there's lots of traffic going by you that is similar in nature to what your production system might be doing? And then also regional density. We know there are certain pockets of poultry production in the state of Minnesota. Now, I say all of these things not because they are bad. They're good. There are absolutely benefits to having a location close to the feed mill or close to the processing plant. There's benefits to being in the neighborhood with fellow farmers, and so you can work with your peers. And so they aren't necessarily bad things. It's just they bring along with them considerations that need to be evaluated to optimize your biosecurity. So remembering that conceptual aspect, the conceptual lens of your business is important to your overall biosecurity plan. The middle tier is structural biosecurity, and these are going to be the fixed cost features, the physical items on your farm that can help you with biosecurity. This is going to be your farm layout. Where have you set your perimeter buffer area? Where are your lines of separation? If you have multiple barns, do you have an office on site that's a separate building? All of those structural things are what aid you in your biosecurity protocols. It might even include where your feed bins are. Those are structures, right? Is the feed bin working properly? Do you have doors that can lock, which reduce traffic in unnecessary places, or prevent unauthorized entry somewhere because of those locked doors? So those structural fixed cost features can really be a benefit to your biosecurity. And the third tier is operational biosecurity. And this is why I'm here, because operational biosecurity is truly the human aspect of keeping your birds free of disease. Unfortunately, it's the least dependable of the 3 tiers of biosecurity because it relies solely on human behavior. So you can spend time working with the considerations that you've discovered are a risk with your conceptual biosecurity. You can ensure that you have structural components in place, but if they aren't being used properly by the people, and you don't have the buy-in from the people, including yourselves as potentially the owner or the farm manager or the primary caretaker, then that biosecurity ceases to exist if it's not, if compliance isn't there. So I want to bring your attention to this graphic, which I know Dr. Voss has shown in previous weeks, and hopefully you've seen it in different places. But this is going to relate specifically to the season that we are in now, the season of fall, our unusually warm weather as we enter the middle of November, and as we are entering and navigating through this season of HPAI that we're currently experiencing. And it relates all to some conceptual biosecurity, and it's adapting what is happening because of what you are noticing and observing that's happening around your farm because of the seasonality changes. So being observant is one of the best things that you can do, and heightening that awareness of what is happening around your surroundings. Do you see waterfowl around your farm more than normal today? Are you in a control area? What things need to happen because of that? Can you limit the number of entries into your barn potentially? What sort of things can happen and be adapted to optimize your conceptual biosecurity as we navigate this? Also, biosecurity takes a team, and I'm going to go into this a little bit in the next slides about retraining everyone. And I want to put emphasis on the word retrain, because retraining everyone that enters your premises is going to be a deeper process than just reviewing your plan that you have to do annually for your NPIP biosecurity plan audit. Retraining and having conversations with the people who enter and exit your farm premises are going to allow for discussion, and that will help build accountability between everybody who's entering and exiting your barns and or your farm premises. And this includes all of your weekend caretakers, any substitute caretakers, especially as the holidays are coming up. We might want to try to take some time away from home if possible. The veterinarians that you work with, any service providers, any company crews, and of course your daily employees still need retraining, even though they're going through those actions every day, probably multiple times. Retraining is still a very important part, and it needs to happen likely more than one time per year, which is required for your NPIP audit. And why I'm on this bandwagon right now of retraining is a result of some research that I completed as part of my PhD program at the university. And obviously my role in extension is to help teach and provide you as producers the tools that can make you successful. So it's well known that compliance of biosecurity protocols can be really challenging, regardless of the animal species. It happens in swine industry, it happens in poultry, it can happen in dairy, beef, whatever. So compliance is a challenge because remember that operational biosecurity, it's human behavior. So I wanted to be able to assess if there were teaching methods that were going to be more successful on the biosecurity entries and exits. So we embarked on a research project at the university. We set up 3 simulated Danish entries, and we had students, staff, and faculty from the university go through the Danish entries. Some of them had a lot of experience, meaning they actually grew up on a swine farm or a hog farm. They worked on the animal farms on campus. So they were familiar with and engaged in actual biosecurity practices. Others were academically very knowledgeable about biosecurity. And I can pick on Dr. Cardona. She was one of the participants in our research project. She's very, very knowledgeable about biosecurity. So our participants either, they were randomly assigned one learning style for the 3 different entrances that they had to participate in. So they either had to listen to the instructions, they could read the instructions on their own and take as much time as necessary, or they got to watch an animated and narrated video. So they got the instructions one of 3 ways. Then most of the participants came on 2 different occasions. So they had their first initial visit, and then 4 to 6 to 8 weeks, some of them stretched out to 8 weeks, they came back and they went through the Danish entries again, but they were not provided those instructions a second time. So they were expected to rely on their recall of what they had learned the very first time that they went through the biosecure entryways. And I mentioned a little earlier that there were 3 different protocols, and briefly, there were 3 rooms. The first room only had 3 steps, and the 3 steps were to sign a visitor's logbook, to take off any personal items or outerwear. So I'm talking like hats, caps, jewelry, sweatshirts, jackets, etc. And then the third required step in that room was to do something with their phone. And there were 5 options of what they could do with their phone, and only one of them was considered an error. So they had the option of like leaving the phone in their jacket pocket, for example, or leaving it on the table in the biosecure entry, or they could put their phone inside a plastic Ziploc bag and then carry it with them on their person. And so those were the 3 basic steps that they had to go through in room number 1, or protocol number 1. Moving to protocol number 2, they that's where the line of separation was introduced. So they had the same 3 first basic protocol requirements. And then step 4 was to remove their footwear and then cross the line of separation put on barn specific footwear. And then step 6 was to sanitize their hands with hand sanitizer. Room 3, or protocol 3, again, we had the same 3 basic steps of the visitor's logbook, removing outerwear, and doing something with their mobile device. And then step 4, again, was removing footwear. But our line of separation in this room was a bench, and so it was a physical barrier, as opposed to the second room, the previous room, only had tape on the floor. And I think this is a long established point of knowledge that a physical barrier at the line of separation has a much higher compliance level with crossing it properly, whether it's a bench or a chair or a curb of some sort, so that there's just some sort of physical barrier there. So then the participants cross the line of separation by sitting on the bench and kind of doing a sit and spin or scooting their legs around the side, putting on barn specific boots. And then in this room, they also had to put on a lab coat to simulate putting on barn specific coveralls. And then they moved to step 7, which was the hand sanitizer, hand washing. And then in all of the rooms, they went to this fictitious barn, and they had to do 3 very simple, really kind of elementary type tasks in order to simulate having to do barn chores and to distract them from what they were actually being tested on, which was their biosecure entry and their exit protocols. So the participants would do their barn entry in all 3 of the rooms separately. And then they'd go into the barn, and they would put together a puzzle quickly or take readings off of a weather meter, things like that. And then they were expected to come back through the room and then redo those protocols in reverse. All of that said, the room that a participant started in was randomized. So we may have had a very inexperienced, naive person be assigned that they had to start in room number 3 with the most number of protocols. And then when they were done with room 3, then they circled back around to room number 1, completed room number 1, and then circled back to room number 2. Sometimes we had very experienced people have to start in room number 1, and they were like, this is super simple. Why is this so easy? And then they progressed through the other 2 rooms sequentially. So their starting protocol was also randomized along with the teaching method that was provided them. And then we also did record what their experience level was, and I sort of explained that already, whether it was they had experience physically doing biosecure protocols or academically they were book smart about it. And what we were looking for was the number of errors that each person committed, essentially, against the protocol that was provided to them. And we counted this through their entry and then also again on their exit. And all of the participants were video recorded, and we had 90 participants. They went through 3 entries and 3 exits. So I essentially had 6 videos per person, and I watched videos for hours and hours and hours and hours and counted errors. We also evaluated time because it's common sense that the more protocols that there are in a biosecure procedure, it's going to take more time. And as producers, you're likely thinking about time is money, right? So we wanted to be able to quantify some of those things. I'm only reporting some of those results today because I only have so much time. So what happened? All of those 5 things that we were looking at, the education method, the protocol, what room they started in, their experience, the only thing that could predict errors was the time between visits when people were entering the biosecure rooms. So on the second visit, there were 1.4 times more errors committed by the participants than there was on their first visit. And when they were exiting, they're coming back through, and after they had done their chores, there were 1.2 times more errors on the second visit than the first. So what does this mean in practical application? That truly just tells me that even though you likely very effectively trained anybody as they came in on their first visit, you have a new hire, you have a new veterinarian who's visiting, you have a new service provider, a new electrician who's working, and then they're called back 6-8 weeks later, you cannot assume that they truly remember the full protocol and how to correctly administer that protocol. So that's what that means, and that's what that tells us. The errors, the exit errors, according to the protocol, we had predictors that obviously when there's more steps in a protocol, that leaves more margin for error, right? It makes sense, it's logical. So there were 1.5 times more errors with 6 steps than there were with 3 steps. And there were nearly 2 times more errors when there were 7 steps versus 3 steps. But if you notice, one really key word here is it's the exit errors. The protocol on entry wasn't necessarily, we didn't find any statistical differences because I think human nature, they were thinking really hard about what protocol they had just listened to, like the instructions they had just listened to. But by the time they were exiting, they were like, okay, I'm done. I'm on to the next thing. Their minds were already moving on and moving forward. So I think that's where we're seeing these errors occurring because people are just, they're ready to move on. And so they're not necessarily present during their exit protocols. So what kind of errors did we actually see? One happened frequently, and that was not removing outerwear. And so people were leaving on watches and jewelry, their hats or their caps, stocking caps. They were leaving layers on, so flannels, vests, sweatshirts, and they weren't necessarily removing keys. So what this tells me is we need to be very explicit in our instructions. And making that very clear of what the expectation is for your premises. One of the other errors that was commonly found was that doors were not being fully closed. And remember now there was an exterior door in all 3 rooms. So there's 3 doors there. And then it was a one-way flow into the fictitious barn. So then there was another door at the end of each room. So there were a total of 6 doors. So 18% of that, of those openings and closings did not close fully on that exterior door. And then there was a 23% error rate for the door between the biosecure room and the barn. What is interesting is that protocol 3 or room 3 had a 30% error rate for the exterior door and the barn door, all in itself. So room 3 is what really contributed to those 18 and 23% error rates because most of them happened in room 3. So what does that tell us? It was likely the structural component of those doors. They happened to be accordion style doors that had a magnet, and they were very they were tight in room 3, I guess is the easiest way to explain it. And so you actually had to pull a little harder and put more tension on the accordion door to get the magnet to latch. And so I would consider that a structural biosecurity challenge. So we go back to the beginning few slides where we were reviewing those tiers of biosecurity. Structural is those fixed assets. And if they are not working correctly, how can you expect a person under operational biosecurity to be 100% compliant? So that's something that I think we probably would have seen, obviously, very different results for the error rates if we had gone and fixed, adjusted, replaced, whatever, those doors in room number 3 to make them actually more user-friendly. Other areas that we saw was that footwear was removed. Sorry, that the removed footwear in room number 2 was sort of sneaking across the taped line of separation on the floor. And then in room 2 and room 3, that feet were touching the floor on both the clean and the dirty side of those 2 rooms. So those are a summary of some of the errors that we saw. Now, I don't want to always be such a negative Nelly. There were really positive things that were happening in the project, and every participant did sign the visitor's logbook. They signed it coming in and they signed it going back out. Phones, I thought, were going to be a much bigger challenge. You have to remember, we were on campus. We were dealing a lot. Well, half our participants were in their late teens or 20s. And so I was sort of assuming, I was making this assumption that with that age, they weren't going to be willing to let go of their phones or do something with their phones because they were just latching onto it. But I was pleasantly surprised. And of the more than 300 entries and exits, only one person did not do something with their phone visibly that I could see. So they were making choices to leave it in the entryway, that they would even put it in a baggie and leave it in the entryway, or they were carrying it in a baggie and then taking it with them into the barn. For both rooms 2 and 3 with the line of separation, footwear was always removed. I think that's just become part of the culture and the expectation now with biosecurity. And again, I had mentioned earlier about having a physical barrier at the line of separation. This research is reiterating that that physical barrier really does make a difference, because footwear did not cross the line of separation into the clean space. So though there are good things happening in biosecurity, and so we really need to be able to also feature that in addition to errors that are happening. So briefly, I just want to talk about the time. We know that when there's more steps, it's going to take more time to complete those entries. And remember when I talked about that participants were randomly assigned a room to start in all 3 of the rooms, for the people that were assigned those rooms as their very first room of their visit, it took them more time than their counterparts who went to that same room for their second or third room during this research study. So what that's telling us is the very first time a person is on your premises, expect them to take more time to go through those protocols. They are going to be learning, and maybe they're very well versed with the physicality of actually going through biosecure entries, but things are going to be different at each farm site. Locations are going to be different. The layout of your Danish entry or your biosecure entry are going to be a little different. So people are going to take more time to get their bearings. And if you've heard me say it once, I'm going to say it again. The biosecure practices are a very choreographed dance for each person's individual needs. And so this is also the time that they're going to take to try to figure that out, of what's the best way for them to physically do these procedures in each room. But it also demonstrates, this slide and this data also demonstrates that once they've done it a few times, it's going to become a little bit more routine. There's going to be some memory there as much as possible, and time will decrease on their subsequent visits. Other notable observations quickly that need to be thought about is that 77% of all of the entries and exits, the people needed some form of physical support when they were removing and putting on barn-specific footwear. So this means they were, in our case, because the rooms were very narrow, they were actually putting their hand against the wall and then being able to take off their footwear. What does this mean in practicality? Awareness, for one. Two, do you have something in your biosecure entry that can be used as a physical support? And three, is that part of the cleaning and disinfection protocol for your entry area as well? And then the other notable observation was that 63% of the lab coat wearers in room number 3 did not fully button the garment. To their defense, they were not told to button the garment. Their only instruction was to put on the lab coat. So again, practicality, this goes back to that KISS method and keeping it simple. If your expectation is that they take off sweatshirts and vests, it needs to be explicitly discussed or written in your protocol. Same with if you're putting on coveralls or lab coat, it needs to be explicitly expressed that that's the expectation in your protocol. It's a very simple but pretty poignant discovery, in my opinion. So in conclusion, the education method didn't have an effect on the number of errors. What it came down to was the time between visits. Site-specific experience did have an effect on the time that it took to complete the protocols, and compliance changes over time. That's all I have. If you have any questions or you want to talk to me more about any of these results or anything about your plans, my contact info is here. You can probably always find it on MTGA's website. But please feel free to reach out, and there's no judgment here. I will talk and I'll read through anything or ask any questions. So thank you.
Thank you, Abby. That was that was interesting and highly educational for me, witnessing it for the first time. We will share these resources with everybody on the MTGA members only portion of the website, and we'll follow up in wingtips again with the recording of this and information provided by our speakers today. I do not see any questions in the chat. But if we do have any questions afterwards, I'll be sure to forward them to the appropriate speakers. So this will be the last of our webinars that we have this fall. We do have some in-person meetings in December that we'll be advertising here very shortly. Just like this webinar, the previous 2 webinars can be found on the MTGA website and in previous editions of wingtips that have hit your email inbox over the past few weeks. If there is a drastic change in HPAI or response programs or resources for members, we will schedule a last-minute webinar in December. But again, don't plan on one in December because we are having in-person regional meetings. And with that, Shauna, Erik, and Abby, thank you for joining us today, and thank you to everybody who attended this and the previous webinars. Thank you.